Hi guys, welcome back. Today I'm going to be sharing a video with you about the healthcare system in Ghana. I've done a video on this about two years ago or so, and I really wanted to do this video to kind of update what I said. The healthcare situation in Ghana can be very up and down. A lot of it depends on your level of the level of finance that you have available, and sometimes the biggest thing that I've realized here is sometimes if you have an emergency or you need to go to the hospital, if you don't know the right questions to ask, you can easily be overlooked and you can find yourself in situations that perhaps you didn't want to be in. So today I'm going to be sharing a story with you from a young lady who had her own personal experience of the healthcare system in Ghana here. And so I really want you guys to watch and just take note and really just listen to what she's saying, because it's something that affects us all. Health is something that affects every single one of us. So guys, just pay attention to the video and let me know your comments down below. Can you tell me, what do you think of the healthcare system in Ghana?
I believe there are good healthcares, and I believe some of them to maybe from my experience, I've had a couple of them that I feel they should address, or they should really find a solution to it, because some of them I feel they neglect the patients a lot. Sometimes I personally feel they are being forced into the healthcare because of the way they handle the patient.
Yeah.
But then basically it doesn't mean every healthcare is like that. There
Absolutely.
are most of them that are good. So I believe this is what I think about.
Okay, so you feel that there's some good ones and there's some that need to be improved.
Exactly.
Okay, so you've had your own personal experience of a situation that happened. So would you like to share that?
Okay, it happened just last year. I went to one of these clinics, and actually where I was going initially was a very good place, but because of financial constraints, I decided to just, when it was almost I think 2 or 3 months, I moved to a place that is closer to me and a little bit cheaper. But then I don't know, everything was okay till it was time for delivery. I went to...
So you were pregnant?
Yes,
Okay.
I was pregnant, and I gave birth there. That was on the 15th of November, just last year.
Right.
I gave birth on the 15th. That was on a Saturday or so. Then I was just discharged the following day. Then I was asked to come on the 3rd day. So we came back on the 3rd. That was a Monday, and the baby they checked on the baby. So we came back home, and I realized that he wasn't eating well. And
But you gave birth okay?
Yes, I gave birth. Everything was perfect. We were discharged. Just I was healthy. The baby was healthy.
Yeah.
We came back the following day. The 3rd day we went back for checkup, and they said everything was fine. So when we came back home, I realized the baby wasn't eating well, and his eyes was a bit yellowish.
Okay.
So I was a bit nervous. So
Yeah.
I spoke to my mom about it, and she was like, okay, then why don't we go to the clinic the following day? Because we were asked to come, I think, a week after or some days after, but because of the way things were going, I decided that we should go back and check. So we went back to the clinic, and I don't know what happened. I was nervous when I got there and they examined the baby. They said I'm being too emotional and that there's nothing wrong with the baby. And I told them, no, my baby
How old was the baby?
It was just 3 days or 2
3
days.
days, okay.
3 days old.
But you felt something was wrong?
Yes, his eyes was yellowish and he wasn't eating. So within that 2 days I've spent with my baby, I knew how he was. He wasn't the type who eats much, but at least he eats. But this time, the whole night, he wasn't eating. So I was really worried. So we went to the clinic. They were telling me I'm being too emotional, and that's my first child. I said no, this is my second child. But then I wasn't comfortable with the baby, the way he's behaving. So they examined him and they told me it's nothing. I should go and come the following day when it's my time to come. So I said okay. So they are the professionals, so what can I do? So I came back So when I told them about the yellowish eyes, the doctor asked me, she's a midwife, she asked me to come and sit under the sun early morning.
Because it sounds like jaundice, that's why, and you sit under the sun.
She didn't even mention the jaundice. She just said I should just sit. That was all she said. So I was like, okay. So the following morning I tried to do that, but the weather wasn't even favorable, so there was no sun and all that, and it was getting bad, so I couldn't bear it. So I still went back again,
and the baby still was not eating throughout this
it was getting worse, honestly. So I went back again, and this time the midwife wasn't around, but the nurses were there, and everything was slow, but I was really nervous. So it got to a point they realized that no, the baby wasn't really reacting well. That was when they called her again, and they told me, she said, after about 2 or 3 hours, and they told me, she said they should refer me to Kolebu.
Right.
That was what so we rushed to Kolebu with my mom. I was really, really nervous. Mommy was. So finally we got to Kolebu, and everything was slow. Honestly, everything was slow. The baby was, I was seeing my baby dying in my arms, and there was nothing we could do. But then we got there, and then they were telling me, just say join the queue and all that. They told me health insurance. So I told them, fine, if even I have to pay, I'll put the health insurance down, because currently it's about the life of my baby. And the one nurse told me that if even I pay, I'll still have to join the queue.
So they didn't look at the baby first to make
she just said we should just sit. So it's a very difficult experience. I didn't even know I could be sharing it.
And that's why I said I really appreciate you for doing it, because I understand, because I'm a mother as well. So as you're telling your story, I'm also feeling your story.
So they told me that I should still go through the process. So I said, okay, if it's the same, then I had to go through. I went to join the queue for the health insurance, everything, whilst mommy was sitting in the queue. So later on, whilst we were going through that, I finished everything. I was just standing there. We were waiting for them to examine the people before attending to the baby. Then this elderly nurse passed and saw the baby and shouted at them and told them that this is an emergency. They should attend to the baby. So that was when they started rushing here and there, and they did what they had to do and sent us to the emergency ward or something for the children. We got there, and that place, everything was slow. So I was like, is it because they've seen so many deaths or so? It's like they didn't really care. The way I was,
right?
I was expecting them. Fine, it's not my job, but then I'm human, so I was feeling that pain. So they took the baby, everything. They asked me to do all the lab tests, everything. So mom was attending to the baby. I went around. I was getting out of my mind. It got to a point I was going for the lab, and a car nearly knocked me down. By the time I came to my senses, someone has held me. The car has parked from this side. Traffic, they've all parked, and I was crossing. So I just realized that, wow, this is serious. I went to do everything, came back to the where my baby was, and I was told that I should go home and get his things, because we are going to spend the night there. So I told mom to stay back. I couldn't bear stay in the hospital, so I went to get the things. So I was at home, I'd got the things, and I just requested for boats. I was about going back, and my mom called me, asked me where I was, and I said, oh, I'm about to leave the house. And she said, oh, okay, I should come. So when I got there, I met a friend, a doctor friend of mine. She's a young doctor, and I think I met her when I was going to the lab, and she asked me what I was doing there. That was when I told her my baby wasn't well. And she said, okay, so she will come there and meet me. So when I went and came back, she was there. So she met me, and she started talking. She was being nice, and she was like, she wanted to talk to me. They want to talk to me. You know, the way the whole thing was, I started getting more nervous. I asked her, how is my baby? She said, oh, baby, it's okay. They just want to talk to me. So I said, okay. So they called me and my mom, and they were trying to tell me the baby had jaundice, and that it was not detected earlier. So it entered into his brain and all that. So if even the baby had survived, he wouldn't have been normal. So God knows, I don't know. So eventually I had lost my baby, and I don't know how I took that. I don't know how I was able to go through that till now. But then it was just 2 days ago, I was telling my mom that November baby will be 1 year. I still have him on my phone. They keep telling me to delete, but
no, don't. He's a part of you. He grew inside you, so.
And it's been very difficult because every time I see any mother with any baby, it's really hard because my auntie is one is she works in one of the hospitals, and she was like, why this time jaundice, they don't allow jaundice to kill babies because it's something
I've
that
never
can
heard of that myself.
So I was like, I don't know, if they had listened to me the first time I brought the baby, and they had even examined the baby well and even referred me, maybe things wouldn't have gotten that bad. But they neglected everything. I was really hurt, but then what could I do? I feel we are in a system that I don't even know if there is justice. So I just decided to just let go. It's been very difficult for all of us.
I'm sure.
As well, but then I still trust God. So
yeah, no, I'm sure. I'm really feeling your story for you, honestly, because like I said, I'm a mother as well, and I cannot imagine going through what you've gone through. And I mean, like you said, it was only just November gone, and it's so raw, you know. So I really do appreciate you talking to me. I know it hasn't not been easy for you. I'm sure it's brought up a lot of things. But I feel like it's also important for you to share your story so that, because I'm sure it's not only you that has been affected by this, it affects a lot of people, a lot of women, you know. So by telling your story, somebody has to listen and something has to change, you know. So I really appreciate you so much.
thank you.
Can I give you a hug? Thank you for talking to me. I really appreciate it. Guys, there you have it. It's an emotional situation for anybody to be in, you know. It was a difficult story for the lady to express, and I'm so grateful that she did decide to share it with me, because this is not the only time this story has been experienced. It's happened to many people many times, and it continues to happen. You know, we have to look out for each other. If you can help someone that needs help, help them. You know, lead people in the right direction when it comes to healthcare situations, stuff like that. But that's all I have to say. I have nothing else. The video just said it all, basically. If you haven't already subscribed, please do subscribe. Hit the subscribe button for me. Hit the notification bell. And until next time, guys, Noti Papa, I'm out.